Welcome to Paper Biopsy, everyone. In this episode, we are going to talk about a very interesting topic, which is about pulp autotransplantation.
That's right. Its topic caught our attention because this article suggests that in young individual, primary tooth pulp might be used as a natural biologic scaffold for the regenerative endodontic treatment of the young permanent teeth with the necrotic pulps or apical periodontitis. You can find the details of this article in the description.
Wow, that's fascinating. So, what did the article do exactly?
The article performed the procedure on the 4 patients with the age 8 to almost 11 that overall include 5 previously traumatized and necrotic maxillary incisors that they were treated with a regenerative endodontic treatment protocol that used 2.5% sodium hypochlorite and placement of the calcium hydroxide in the first visit. After 4 weeks, the intracanal medication was removed and the whole pulp tissue harvested from the neighboring maxillary primary canine and was transplanted into the disinfected root canal.
Nice. How much time passed between 2 visits?
The interval was between 4 to 8 months.
And what about the methods that are used in the second appointment?
Yes, before transplantation, a disinfection and isolation protocol was performed to acquire sterile pulp samples. The oral cavity was rinsed with the chlorhexidine mouthwash. After that, local anesthesia was performed for the teeth. Then scrubbed them with povidone iodine and a scrubbed rubber dam was applied. The isolated crown surfaces were polished, followed by scrubbing with 2% chlorhexidine and sodium hypochlorite for 2 minutes.
Well, sorry to interrupt. As we know, regenerative endodontic treatment is done by inducing bleeding for revascularization. Did they do it also or no?
It's a good question. The answer is no. There was no apical bleeding before the autotransplantation.
Interesting. So, what happened during transplantation itself?
A mechanical pulp exposure was created on the donor primary maxillary canine. A new sterile barbed broach was used to remove the whole pulp to provide enough pulp volume to fill the permanent root canal. Thereafter, the whole pulp was quickly released by the sterile tweezer and gently inserted to the recipient root canal by using disinfected gutta-percha cones, which lubricated with the blood volume from the primary canine root canal. And a non-staining MTI coronal barrier was placed over the primary tooth.
And I think this is the stage that everyone wants to know about the results.
Yeah, sure. 3 patients were followed up for the 24 months and 1 patient for the 12 months. All teeth demonstrated radiograph evidence of the complete periapical healing, a slight increase in the dentinal wall thickness, and continued apical closure in the absence of the clinical symptoms. All teeth showed a blunt narrowing of the apical region rather than the typical conical apical closure pattern. A positive response to the cold test was obtained in 1 incisor at the 12 months and in 2 at the 24 months. Whereas the remaining teeth did not respond to the cold test or electric pulp test at any recall period.
Wow, that's really interesting. I never realized that primary teeth could be so useful.
Yes, it's pretty amazing that what we can do with them. And the fact that the entire treatment can be done in a clinical setting without any need for the additional equipment, laboratory procedure, which can be a huge advantage for this procedure.
I can see why this would be particularly beneficial for children and young patients. Actually, it's great that they don't need to go through the discomfort of peripheral blood collection to provide the scaffolds.
Yes, exactly. And the fact that the stem cells in the deciduous pulp have a higher proliferation rate rather than those from the adult human teeth means that the treatment has a better chance to success.
Mm. It's also really encouraging to see that all of the teeth in the study showed complete periapical healing and continued apical closure. And the fact that there was a slight increase in dentinal wall thickness is really promising.
Yes, it's definitely positive outcome. And the fact that the donor primary canine were free of the clinical symptoms and showed radiographic evidence of the physiologic root resorption, which is a further evidence of the success of the treatment.
I agree. It's really exciting to see the potential of this treatment. I wonder what other applications it could have in the future.
Yes, there are definitely opportunities for more investigations. For example, transplantation in the multi-rooted teeth, like the first primary molar, which is more prone to the caries, and also involving more participants could certainly provide more reliable result.
Absolutely. It will be interesting to see where this research goes in the future.
Well, that's it, friends. Thank you for joining us today. We hope you learned something new.
Yes, sure. And don't forget to join the Purple Biopsy family, subscribe our channel, and never miss a moment. Goodbye.